Timolol is a medication used to treat high blood pressure, and it can be used alone or with other medications. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. It is also used after a heart attack to help prevent another heart attack from occurring. Timolol belongs to a class of drugs known as beta blockers, and it works by blocking the action of certain natural chemicals in your body, such as epinephrine, on the heart and blood vessels. This effect lowers the heart rate, blood pressure, and strain on the heart. Additionally, timolol is also used to prevent migraine headaches. It is important to take timolol exactly as prescribed by your doctor and to follow their instructions for the best results. The daily dosage and the optimal timing of taking timolol will be determined by your doctor based on your specific condition. When taking Timolol Maleate, it's important to follow your doctor's instructions on how and when to take it. Typically, it's taken once or twice a day, with or without food. Your doctor will determine the right dosage based on your medical condition and how you respond to treatment. To get the most benefit from Timolol Maleate, it's essential to take it regularly at the same time each day. It may take several weeks to feel the full effects of the medication when treating high blood pressure. Even if you start to feel better, it's crucial to continue taking the medication as prescribed. For preventing chest pain or migraine headaches, it's important to take Timolol Maleate regularly as directed. This medication should not be used to treat sudden chest pain or migraines. If you experience sudden attacks, your doctor may prescribe other medications to relieve the symptoms. If you don't see improvement in your condition or if it worsens, such as consistently high blood pressure readings or more frequent chest pain or migraines, be sure to inform your doctor. If you experience tiredness, slow heartbeat, or dizziness, make sure to let your doctor or pharmacist know. To reduce the risk of dizziness and lightheadedness, be sure to stand up slowly from a sitting or lying position. This medication may cause a reduction in blood flow to your hands and feet, resulting in a feeling of coldness. Smoking can worsen this effect, so it's best to dress warmly and avoid tobacco use. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to contact your doctor if you notice any very slow heartbeat, severe dizziness, fainting, or other concerning symptoms. While serious allergic reactions are rare, seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. Don't stop taking Timolol Maleate without talking to your doctor first. Suddenly stopping this medication can make some conditions worse. People who have suddenly stopped similar drugs have experienced chest pain, heart attack, and irregular heartbeat. If your doctor decides you should stop taking this drug, they may have you gradually decrease your dose over 1 to 2 weeks. When you're gradually stopping this medication, it's best to limit physical activity temporarily to reduce strain on your heart. If you experience chest pain, tightness, pressure, or if the pain spreads to your jaw, neck, or arm, or if you have unusual sweating, trouble breathing, or a fast or irregular heartbeat, seek medical help right away. If you have any allergies, especially to timolol, or if you have certain medical conditions, talk to your doctor or pharmacist before using this medication. Before using timolol, let your doctor or pharmacist know about your medical history, including heart rhythm problems, heart failure, breathing problems, kidney or liver disease, overactive thyroid, allergies needing epinephrine, blood circulation problems, mental/mood disorders, or a certain muscle disease. This medication can cause dizziness, especially when combined with alcohol or marijuana. Avoid driving or using machinery until you know how it affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. Before having surgery, inform your doctor or dentist about all the medications and products you use. Timolol may prevent the fast or pounding heartbeat associated with low blood sugar. This medication may also make it harder to control blood sugar levels in diabetes patients, so it's important to monitor blood sugar levels regularly and report any symptoms of high blood sugar to your doctor. Children using this medication may be at greater risk for low blood sugar, especially if they are not eating regularly or are vomiting. It's important to ensure that children eat regularly and to notify the doctor if they experience symptoms of low blood sugar. Older adults may be more sensitive to the side effects of timolol, including dizziness and tiredness. If you are pregnant, only use this medication if clearly needed and under the guidance of your doctor, as it may harm an unborn baby. This medication can pass into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. Drug interactions can impact how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication without first consulting with your doctor. One product that may interact with Timolol Maleate is fingolimod. Additionally, some products contain ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist about all the products you are using, and ask for guidance on how to use them safely. This includes cough and cold products, diet aids, and NSAIDs such as ibuprofen or naproxen. If someone has taken too much Timolol Maleate and experiences severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. Symptoms of an overdose may include a very slow heartbeat, severe dizziness, extreme weakness, fainting, and difficulty breathing. It's important not to share Timolol Maleate with others. Remember to discuss with your doctor about making changes to your lifestyle that may help this medication work better, such as stress reduction programs, exercise, and dietary changes. Also, make sure to have your blood pressure and pulse checked regularly while taking this medication. You can also learn how to check your own blood pressure and pulse at home, and share the results with your doctor. Your doctor may also recommend lab and/or medical tests while you are taking this medication, so make sure to keep all medical and lab appointments. Don't forget to consult your doctor for more details. If you forget to take a dose of Timolol Maleate, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at your regular time. Don't take 2 doses to make up for the missed one. Make sure to store your Timolol Maleate at room temperature, away from light and moisture, but do not store it in the bathroom. Keep all medications out of reach of children and pets. When it comes to disposing of Timolol Maleate, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or you no longer need it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember to always handle medications responsibly to ensure the safety of your family and the environment. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.